So, hello everyone, my name is Devanshu. Welcome to the channel GDC English. In this video, we're gonna have another set of MCQ which consist of anti-anginal drugs. Okay, so anti-anginal drugs are very important for you guys to understand because direct questions may arise from this part also. Okay, so let's discuss some MCQs, important MCQs over anti-anginal drugs. Okay, so the first question goes way like this that nitrates are used for all of the following conditions except. Okay, so among the following nitrates are used for all of the conditions except one is not the condition of nitrates to be used. Congestive heart failure, yes, it is used for congestive heart failure because it will do the venodilation, and through which the preload and afterload decreases and leads to the decrease in PP. Okay. Cyanide poisoning. Cyanide poisoning, yes, it will also be used in cyanide poisoning because it will form the methemoglobin, and that methemoglobin is responsible to counteract the cyanide. And this is the reason behind the nitrates are useful for cyanide poisoning. Particularly, amyl nitrate are used as an antidote for cyanide poisoning. Okay. That question is very much important. In recent exam, AIIMS Pharmacist, nitrites are the antidote of cyanide poisoning. This question has been asked. Okay. Esophageal spasm, yes. Whenever there is a spasm, nitrites have a condition to dilate the vessels. So whenever there is a dilation of vessels, the spasm will be released. Spasm will be released. Renal colic, no, it is not used in renal colic. Renal colic in the condition where you will see the kidney stones in urine. Okay, kidney stones in urine. There's an obstruction of urine outflow. Obstruction obstruction of urine outflow. Okay, got it? Now that nitrites are not used in the renal colic part. Fine. So this is the answer for you guys. But note in your notes that nitrites are the DOC as an antidote for cyanide poisoning. It is also used in congestive heart failure because it decreases the oxygen demand. It decreases the oxygen demand because of decreasing the preload. Okay. Esophageal spasm, yes, because it dilates the vessels and it will ultimately release the spasm. Okay. Renal colic, it is not used. So next question. Nitrates in classical angina acts by. See, if there is an option of veins and there is no options of arteries, you will put the answer is veins as a correct option. But suppose if you get the option as arteries, and for example, you have another option that is both veins and arteries, veins and arteries, then you will take this as an your correct answer because nitrates are the compounds which dilates both veins and arteries. They are vasodilators. Vasodilators means they're gonna dilate the veins as well as the arteries. Okay, but according to this options, you will try to tick the veins over here because there is no arteries as an option. Okay, chalo. Next question is nitrates decrease myocardial oxygen consumption by all of the following mechanisms except. Okay, so by increasing the left ventricular and end diastolic pressure, okay, by direct reduction of oxygen consumption of the myocardial cells. Yes, nitrites gonna decrease the myocardial oxygen consumption because it will decrease the preload. It will decrease the preload. What is preload? Preload is the blood coming back to the ventricles or atriums. That is preload. Okay, preload. Preload is the amount of blood and the pressure exerted by the blood onto the atrium or ventricle. That preload is decreased by this nitrates. Okay, so if there is a decrease in the demand of blood, oxygen is with the blood, inside the blood. So if there is decrease in the amount of blood, oxygen consumption will also decrease, isn't it? Yes. So by direct reduction of oxygen consumption of the myocardial cell, so the oxygen consumption will be down. Next, by dilation of capacitance vessels. Capacitance vessels are nothing but the veins or blood vessels. They're gonna dilate the capacitance blood vessels. By decreasing the size of heart, this might be quite different option, no? But yes, it gonna decrease the size of heart. How? Because of the same reason, it will decrease the preload. Preload means the tension, the stretching of the ventricles. Stretching or tension on the walls of heart. This gonna reduce the size of heart because nitrates gonna decrease the preload. That's why it also decreases the size of heart. But it does not increase the left ventricular and diastolic pressure. It's gonna decrease the left ventricular and diastolic pressure. It will not increase. Okay. So the correct option, which is except one, is A. Okay. Shall. Yes. Next question. Nitroglycerin is effective as sublingual medication because nitroglycerin is effective as sublingual medication because. So I have taught you before also that sublingual route allows high lipophilic drugs to be absorbed without going into the first pass metabolism. Okay, so it has to be in the lipophilic nature. Nitroglycerin is a lipid soluble nature, lipophilic. Yes, nitroglycerin is lipophilic in nature. So around the tongue, sublingual, around the tongue, beneath the tongue, there is a lot of lipophilicity inside it. Okay, the lot of lipophilicity inside it. That's why lipid soluble. The drug will be lipid solubilized because of its lipid soluble activity, and which is in non-ionic in nature. Non-ionic in nature. It is not it is not hydrolyzable. No, it is not in polar type. It is of lipid soluble type. That's why it gonna absorb through sublingual route. Okay. So non-ionic, highly lipid soluble. Okay. Next question. Not true about nitroglycerin is that. Okay. Causes AV conduction delay, causes tolerance, causes reflex tachycardia, caused hypotension. See, this one is to right. Okay, they're gonna cause hypertension because of the vasodilation, isn't it? Because of the vasodilation, they cause hypertension. They also cause the reflex tachycardia. How? Because after hypotension, there is an activation of baroreceptors. There is an activation of baroreceptors. What is reflex tachycardia? Reflex tachycardia means when you stop giving the medication, when you stop having the medication, and sudden there is an increase or the rise in the blood pressure or the heartbeats. Tachycardia is related to heartbeats. So there is a reflex tachycardia. Whenever you stop a drug suddenly, and after that, a sudden change in your heartbeat will be seen. That is in increased way. That is called reflex tachycardia because it is happening because of the activation of baroreceptors, which is a vagal response, which is a vagal response. Okay, it will cause hypotension, and due to hypotension, there is activation of baroreceptor, which will cause the reflex tachycardia. Okay, so nitroglycerin also causes tolerance. It is also causes tolerance because nitroglycerin have the SH groups, and after some time when it is consumed regularly, the SS groups gets depleted and causes the tolerance. Causes AV conduction till? No, it is not true. It is not true. So causes tolerance? Yes, it is right. Causes reflex tachycardia? Yes. Causes hypotension? Yes. Okay. So which is not true? Causes AV conduction till. Okay. So nitrates are helpful in cyanide poisoning by. Okay. See, nitrates are the DOC of cyanide poisoning, particularly if we talk about the amyl nitrate. Okay, amyl nitrate. See, what does nitrates do over here? Nitrates just gonna oxidizes hemoglobin of which charge? Fe2 plus. Yes, Fe2 plus. Now it oxidizes hemoglobin into Fe3 plus, Fe3 plus, which is a methemoglobin, which is a methemoglobin, methemoglobin. Okay. Now this methemoglobin is responsible to complex with complex with the cyanide. Okay. Now this methemoglobin complex with the cyanide and hence stop the poisoning or toxicity of cyanide. Okay. Got it? Now, so what will be the answer of this? Forming methemoglobin? Yes. This will be your right answer. Forming methemoglobin. Combining directly with cyanide? No. Preventing cyanide inhibition of cytochrome oxidase? No. All of these? No. See, there is another brief, if we talk about in a brief manner. So let's take a blank slide over here. So how cyanide, how cyanide causes the toxicity. Okay. How cyanide causes toxicity. Cyanide binds with cytochrome oxidase. Cytochrome oxidase, which has a complex number 4. Which has a complex number 4. In where? In mitochondrial electron transport chain. Okay, and this, when the cyanide binds with cytochrome oxidase, which is a complex 4 in mitochondrial electron transport chain, is causes the blocking of cellular cellular respiration respiration. And what will happen after that? There is a histotoxic histotoxic hypoxia. Hypoxia. So what will be the end product of cyanide poisoning? That is histotoxic hypoxia. Okay, there is a less amount of oxygen present in between the tissue, which is quite toxic towards the tissues. Okay, so this is the mechanism behind the cyanide poisoning. So they might ask you this complex, that on which complex the cyanide binds with cytochrome oxidase, and which of the particular compound does amyl nitrate or nitrate forms, that is methemoglobin. Methemoglobin. And that methemoglobin binds with that cyanide and reduces the toxicity of cyanide poisoning. Okay, forming methemoglobin. Okay, so next. Long-term use of nitrates led to decreased effect because of, just I have told you before, that long-term use of nitrates leads to decreased effect. What is that effect? That is tolerance, isn't it? That is tolerance. And it is because of depletion of SH group in the enzyme. Depletion of SH group in the enzyme. Okay. Sure. Yes, right. Next question. Longest acting nitroglycerin preparation is. So that is from the classification part only. That is longest acting. Longest acting nitroglycerin preparation is pentaerythritol tetranitrate. See, there is a simple trick. Whichever a name is very large, that is a longest acting. Suppose here you will see the penta, here you will see a tetra. So there is a big numbers. Penta 5, tetra 4, long. So big numbers can be long. So you can learn it from this. Pentaerythritol tetranitrate is a longest acting nitroglycerin preparation. Okay, sure. Which of the following is a pure heart rate lowering anti-anginal drug? Okay, what is pure heart rate lowering anti-anginal drug? See, what is pure heart rate? Pure heart rate. See, ivabradine is the right answer over here because it is a pure heart rate lowering anti-anginal drug. Why is it so? Because it selectively inhibits the funny current in SA node. Okay, it selectively inhibits the funny current in SA node. This ivabradine just slows down the heart rate without affecting contractility. That is contractility. And what is contractility? Contractility is the strength of each beat. Okay, what is the strength of each beat? Each beat. That defines that ivabradine just slows down the heart rate, but it does not lower down the BP or without affecting the BP. It just slowing down the heart rate, but it is not affecting the BP. That's why it is a pure heart rate lowering anti-anginal drug. That is funny current. Okay, because SA node is responsible for the conduction, conduction correlated towards the heart rate. Okay, now ivabradine just controls the heart rate, not related to the blood pressure. Okay, so ivabradine would be your right answer. Okay, yes, ivabradine would be your right answer. So, nitroglycerin produces beneficial effect in classical angina primarily by nitroglycerin produces beneficial effect in classical angina primarily by increase in total coronary blood flow, redistribution of coronary blood flow, reduction of cardiac preload, and reduction of cardiac afterload. See, there is a both option C and D. If you talk about C and D, nitroglycerin, that is nitrates. Are nitrates are the drugs which reduce both preload and afterload. Both preload and afterload. Okay, that will reduce the consumption of oxygen as well as the demand of oxygen. Okay, so nitroglycerin acts by reducing of cardiac preload and reducing of cardiac afterload. Okay, so both the options are right. Both the options are right. So no worries. Both the options are right. Okay. Sure. Angina pectoris is what is angina pectoris? Oh, angina pectoris is just like a chest pain. Okay, it is nothing but just like a chest pain. Okay, it is not a body pain. It is not a brain hemorrhage, and it is not an inflammation in heart. It is just like a chest pain. Easiest question. So next one. Yes. Calcium channel blocker with maximum effect on conduction in heart is calcium channel blocker with maximum effect on conduction in heart is. Okay. So calcium channel blocker, one, two, three. These three all are CCBs. CCBs. Correct. But out of which has the maximum effect on conduction in heart? See, verapamil is the drug which has the most effect on conduction in the heart. That's why it is useful for the supraventricular arrhythmia. That's why it is a DUC for supraventricular arrhythmia. Okay, sure. Next, verapamil. Yes, nice. Vasospastic angina. See, angina are of two types. Angina are of two types. First one is classical angina, and second one is vasospastic vasospastic angina. Okay, so classical angina means there is a atherosclerosis. Atherosclerosis means the deposition of deposition of fat or triglycerides inside the coronary arteries. Correct, because of the just cholesterol deposition or ischemia is responsible for the classical angina. But what if about the vasospastic angina? There is a spasm of cardiac muscles. There is a spasm of cardiac muscles which just cause you the pain around this area. Angina is nothing but just like a pain over here in the around the heart. Okay. So vasospastic angina is a spasm is due to because of the spasm of cardiac muscles. Also, vasospastic angina is also known as the variant angina, also known as the Prinzmetal angina. Okay. So vasospastic angina has two more other names, that is variant angina as well as Prinzmetal angina. Okay. So your right answer would be the variant angina. Okay. Sure. The mechanism of action of sodium nitroprusside is, see, sodium nitroprusside is not going to act on any receptor. This is not going to act on any receptor because it will just go inside the blood vessels and release the EDRF, that is endothelial depending relaxing factor. Endothelial dependent relaxing factor. Who it produces nitric oxide, and this nitric oxide releases EDRF, and this will increase the intracellular level of CGMP, that is cyclic guanyl monophosphate. Okay, cyclic guanyl monophosphate. this will cause the relaxation around your blood vessels, and after the relaxation of your blood vessels, what will happen? There will be a decrease in BP. There will be decrease in blood pressure, increase in CGMP levels. Okay. So patient on verapamil should not be given beta blocker as. Okay. See, verapamil. Just we have discussed that verapamil is the most conduction blockage drug, isn't it? Just one of the previous questions we have seen over here. This one, calcium channel blocker with the maximum effect on conduction and heart. Now verapamil. See, okay. Now here if we see a patient on verapamil is already there. No, patient on verapamil should not be given beta blocker as. Patient is with verapamil is already, but beta blocker, why should not be given with beta blocker? Because it will block the conduction over here. Because verapamil is already acting on the SA node. It is the most susceptible drug acting on the SA node. Here, beta blocker is also acting on the SA node. It is also altering the conductivity of the heart, isn't it? So both the drugs will just act on the SA node, and then what will happen? There is a conduction block. There is a conduction block. So that's why there is a question from interaction point of view that you should not give verapamil and beta blocker combinedly, as it may cause the conduction block. Okay, sure. Which one is the drug of choice in treatment of acute attack of angina pectoris? Acute attack of angina pectoris. See, isosorbide dinitrite is one of the shortest acting drug. Shortest acting drug. That is why it is used to be a drug of choice in the treatment of acute attack. Acute attack. Okay, there is a small drug which seems like this isosorbate dinitrite. Okay, this kind of shape of drug is called as isosorbate dinitrite. They just used to keep in here pocket, and whenever he feels like they are having a chest pain around here, they just usually take it and take it around the sublingual part, and automatically they will feel a relief from the chest pain or the angina attack. That is acute attack of angina pectoris. Okay, isosorbate dinitrate because of the short acting drug. Potassium channel opener. Okay, potassium channel opener is, it is from the direct classification. Propranolol, no. Propranolol is a beta blocker. Nitroglycerin, no. Nicorandil, yes. Nicorandil, yes. Nicorandil is a potassium channel opener. Ivabradine, no. Ivabradine is used for the lowering the heart rate. That is pure heart lowering agent. That is, it will act on the funny current. Funny current. Okay. Sure. Next question. Nicorandil. Okay. Hmm. Choose the correct pathophysiology of angina. What is the correct pathophysiology of angina? What will happen if someone is suffering from angina? Oxygen demand increases due to increased heart rate. Okay. Oxygen demand increase due to decreased ventricular contractility. Okay. Oxygen demand increase due to decreased wall tension. Okay. And all of these. See, rest of the part is not right, because whenever a drug, whenever a heart used to pump, while pumping, they need blood. They need blood. And with the blood, they also need the oxygen. Okay. So at the time of increased heart rate, increased pumping, what will happen? There is an increased demand of oxygen. There is an increased demand of oxygen. That is why during the time of increased heart rate, oxygen demand increases. Okay. Yes. Oxygen demand increases. So next question. Agent of first choice in an acute attack of Prince metal angina. I've just told you before that Prinzmetal angina is also known as the vasospastic angina or variant angina. Variant angina. Yes, and we have taken all the question of the those drug only. That drug only. That drug is nothing but nitrate. Nitrates are used as an acute attack of Prinzmetal angina. Okay, nitrates. So nitrates and nitrites generate methemoglobin and has affinity for cyanide radical and forms. Oh, this question should be answered by you guys only. I've just taught you about this that nitrates forms the cyanomethemoglobin. Cyanomethemoglobin. That is, nitrates just oxidizes the hemoglobin into methemoglobin, and that methemoglobin forms a complex with cyanide ion, which forms a cyanomethemoglobin and will reduce its toxicity. Okay, so cyanomethemoglobin is a complex formed after methemoglobin plus cyanide ion. Cyanide ion. Okay, so this is all about the anti-anginal drugs of MCQs. Nitrates are very much important for you guys for GPAT and NIPER exams. Many of the direct question has asked from nitrates only. That's why I have choose to prefer nitrates questions over here. So I hope I have made you clear about these questions. And till then, keep preparing for yourself for something better, something bigger, and something great in your life. Okay? So, good night.